Governor DeWine is still quarantined at home tonight, waiting to take another COVID-19 test tomorrow just to be sure of the result.
Yeah, he says he's feeling confident about the second set of test results he received last night, saying he tested negative for the virus. However, he knows the opposing results may be causing confusion and doubt.
As I know that what happened with me yesterday has caused some questions, and people are asking about it. My understanding is that I was given up in Cleveland at Case an antigen test. Later on at Ohio State, I was given a PCR test. And I wonder if
those two different tests may be the key to understanding what happened. As News 5's Olivia Fecto found out, the two types of diagnostic tests do have different levels of accuracy, but doctors say both are useful.
Antigen tests, the type the governor had in the morning, are less accurate, but they may be used more often to detect community spread, especially among people who are asymptomatic. PCR tests, the type on which Governor DeWine tested negative, are more accurate, but still not perfect.
Both types of tests.
Metro Health doctor Amy Ray says even though antigen tests are less accurate than PCR tests, it's best to assume any positive test equals presence of the virus.
If you've had a positive test, you have to act accordingly. If you have a negative test, but the symptoms are such that you remain concerned, it could be that you need to have a repeat test performed.
But she emphasizes no test in all of medicine is perfectly accurate.
The PCR test is probably, at least 90% accurate. You cannot let the perfect be the enemy of the good, because in medicine, there is no, with this virus, there is no gold standard test because it's not biologically safe to culture the virus.
According to the Ohio Department of Health, neither of Governor DeWine's cases were included in the state's daily case count. That's because antigen tests, the type the governor received in the morning, are not reported in the daily testing number. They are only included in the state's probable case count if they meet another criteria in addition to being positive, such as showing symptoms or evidence the person was exposed to someone else with the virus. As for the PCR test the governor received in the afternoon, it was not counted because it was negative. And that doctor from Metro Health also says she believes the more accurate PCR test should be prioritized for hospitalized patients, healthcare workers, and those who may be at risk for bad outcomes from a COVID-19 infection. Olivia Fecto, News 5.